If you're caught between sleepless nights and rising anxiety, but you're not ready to jump into daily medications or risk addictive sleep medications, hydroxyzine might be the quiet helper you haven't heard enough about. You may have seen it under the brand names like Vistaril, Atarax, other names. And yes, technically it is an antihistamine, kind of like Benadryl, but unlike your average allergy medication, hydroxyzine has calming effects on the brain and nervous system that go far beyond traditional antihistamines. Today, I'll break down how hydroxyzine works, when I use it in my practice, what to watch for, and whether it could be a helpful part of your care. I'm Dr. David Danish, a double board certified child, adolescent, and adult psychiatrist. Hydroxyzine is FDA approved to treat anxiety and tension, and it's also commonly used off-label to help with insomnia. It's fast-acting, it's non-addictive, and it does not require daily use, making it a solid option for patients needing help in the moment. It typically starts working within 15 to 30 minutes with peak effects around 2 to 3 hours after taking it. That makes it especially helpful for panic attacks, sudden anxiety spikes, or bedtime insomnia. Unlike benzodiazepines like Xanax, Ambien, Klonopin, it doesn't cause physical dependence or withdrawal. So patients with a history of substance use, adolescents, or adults who often have issues with addictive medications, it works better without those risks. Hydroxyzine works in two main pathways. It blocks histamine receptors, like Benadryl, which helps your body calm down. But it also blocks 5-HT2A serotonin receptors, which helps your mind calm down. That dual action is what gives hydroxyzine its unique edge over typical antihistamines or sleep aids like Calmade or Tylenol PM or Benadryl. Like every medication, hydroxyzine is not perfect and it's not for everyone. Let's go through what you might notice and what I keep an eye on as a psychiatrist. First, the common but manageable side effects for most you may notice early on. These usually tend to be mild and they tend to go away as your body adjusts over time. Dry mouth, drowsiness of course, some people have dizziness, some may get a headache. Next, there are some effects that show up in a smaller group of people but can be uncomfortable. These happen in less than 1 out of 200 people, but they still can occur and they tend to be dose dependent, so they occur at higher doses as well. Constipation, blurred vision, confusion in older adults, upset stomach like nausea. Now, the rare but important risks to be aware of. In very, very rare cases, in those who are predisposed, hydroxyzine can affect your heart rhythm, specifically by prolonging what's called the QT interval. This is typically only a concern at much higher doses or in patients with known heart conditions or on multiple other medications that might cause the same risk. If you're at risk, I would recommend getting an EKG before getting this prescription. Hydroxyzine also has anticholinergic effects, which can cause trouble with urination in some people, some memory issues in those who are predisposed and geriatric. So it's something I'm careful with using in older adults. Now, just taking a medication is rarely the full answer. I always encourage my patients to pair hydroxyzine with natural body-based tools that reinforce calm and improve sleep. Here's how I coach patients to combine hydroxyzine with lifestyle practices. For anxiety relief, try the 4-7-8 breathing technique. Inhale for 4 seconds, hold for 7, and then exhale slowly for 8. Repeat that for 4 full cycles. I'll also make sure to put a link into a video talking about that breathing approach so I can really walk through it on a slower basis and really teach you how to do it. Hydroxyzine can also pair well with grounding exercises or journaling during a stressful moment, helping calm both body and mind. For insomnia, use progressive muscle relaxation. That means tensing and releasing each muscle group, starting all the way down at your toes and working your way all the way up your body, even up to your forehead as you lay in bed. And don't forget sleep hygiene. Keep your bedroom cool and dark. Avoid screens for at least 1 hour before bed and stick to a regular bedtime, even on weekends. For deeper, long-term help with sleep, I recommend CBTI or cognitive behavioral therapy for insomnia. You can learn more about that and how to access that at SleepScriptMD.com, and I'll be sure to put that link in the description as well. I typically prescribe hydroxyzine for patients who need short-term relief from anxiety or sleep issues. but want to avoid addictive medications, which is a standard part of my practice. It's especially useful when starting an SSRI, tapering off a benzodiazepine, or managing panic symptoms during stressful life events. In younger patients, with those with a history of addiction, I find hydroxyzine gives them peace of mind, knowing they have a non-habit forming tool to reach to when they need it. That said, I'm also cautious about using it daily for long periods. If someone's needing it every night to sleep, it's usually a signal that we need to look at other factors that may be playing a role, including some of the sleep hygiene things I discussed, as well as trying some other treatment options such as the progressive muscle relaxation or various supplements that can work well. I often describe hydroxyzine to patients like this. It's like a calming umbrella for your nervous system. Broad, gentle coverage without knocking you out cold or being addictive. So how does hydroxyzine stack up against more commonly prescribed options like Klonopin, temazepam, Ambien? Here's the short version. Hydroxyzine has zero risk of physiologic addiction or dependence, which makes it stand out compared to those options I just mentioned. Benzodiazepines are, of course, extremely addictive and habit-forming. Ambien and other Z drugs fall somewhere in the middle. They're not quite as addictive as benzodiazepines, but they still carry a significant risk of dependence and high rebound insomnia, along with a myriad of other intense side effects for some people. All of these medicines, including hydroxyzine, do kick in within about 15 to 30 minutes for quick relief. But only hydroxyzine is FDA approved specifically for anxiety without needing to limit its use to a few weeks at a time like the other ones I mentioned. Now here's what I think is most important. If you're looking for a short-term option that won't backfire later, hydroxyzine gives you a calming effect without the long-term baggage. That's why I often use it as a bridge, maybe while an SSRI is kicking in or during a stressful season when daily medications are just not doing enough. Hydroxyzine is not for everyone, of course, but for many of my patients, it offers a middle path between doing nothing in the moment and diving into stronger medications that may lead to addiction. If you're feeling overwhelmed by anxiety or can't seem to fall asleep and you're unsure about where to start, hydroxyzine may be a good first step. If you want to explore whether this is right for you, log into the Mind Vault on drdaviddanish.com for my full, more thorough breakdown on hydroxyzine, including when I recommend it, when I don't recommend it, how it compares to other medications that might be used for these symptoms, and red flags to watch for. You can also grab my free sleep hygiene cheat sheet. It's packed with simple science-backed tips to improve your sleep naturally. And for quick professional help with sleep without habit-forming medications, check out SleepScriptMD.com where you can start CBTI. You can see if you need an at-home sleep test, or you can get a prescription if you fit criteria for a safe, non-habit-forming sleep medication. If this helped you or may help someone you know, please click the like button, subscribe, and share it with someone else.